Hello, everyone. Thank you all for joining us today. My name is Claudia. I am the project coordinator with Empower Idaho. If this is your first event with Empower Idaho, just a little bit about us. We are a program of Janus based in Boise, Idaho, and we provide educational and advocacy for adult participants and providers of behavioral health services throughout Idaho. And we hold several events similar to this webinar all throughout the year. And I put the link to our newsletter in the chat box. So we encourage you to register for our newsletter just to stay up to date on events that we'll be hosting. We have a lot of really exciting things coming up, just like this event. Just a quick few kind of housekeeping things for the tech on how to use this system. If you are not familiar with it, on your end, the question and chat box, they are combined within your control panel. If your control panel is not open, you can go ahead and click the orange arrow and then it'll pop open and you will see a question/chat feature. So any information or any questions that you have throughout the presentation, definitely feel free to use that. If someone would like to message in there really quick to make sure that it's all working, that you can hear us fine, that would be great. I will keep an eye on the chat box. So yes, if someone could message in there really quick. Awesome. Hello. Thank you, everyone. Okay, perfect. So that is all working. So yes, definitely feel free to use that feature all throughout the session today. If you have questions for our presenters, I will be able to relay those questions back to them. And we just thank you all for joining us again. So I'm going to just briefly introduce our presenters that we have today. So the Idaho Strong Team is a FEMA and SAMHSA funded grant program designed to provide resource linkage and emotional support for community members during the COVID-19 pandemic. One branch of Idaho Strong is the statewide COVID-19 Crisis Community Resource Specialist Team. This team is comprised of responders at the Idaho Department of Health and Welfare's Division of Behavioral Health, whose role is to help connect Idahoans with community resources and organizations to build resilience. Each CCRS is aware of local resources for those who are in need and is available for brief one-on-one or group talk sessions to help develop coping skills and positive thinking. The grant program strives to help Idahoans understand the pandemic as a natural disaster with resulting emotional, cognitive, and behavioral impacts. In response to this disaster, Idaho Strong empowers people to advocate for themselves and to make positive change in their thought patterns through mindfulness and connection. So now I'm going to hand it off to our presenters today.
Hi, everyone. Thanks, Claudia, for that introduction, and thanks, Empower Idaho, for hosting us today. As Claudia mentioned, we are part of the Idaho Strong team, and we're here to talk to you a little bit about community resilience during COVID-19. My name's Lillian Toomey, and the rest of our members will be introducing themselves in a few slides. A couple of housekeeping notes. In listen-only mode, you don't need to worry too much about being mindful of your mic, but thank you for being here, and thank you for also actively participating in polls and in the chat. We'll have a poll question in a few slides, and we'll also have an opportunity for audience participation where we'll have you enter some items into the chat. Finally, if you have a way to write things down, either Microsoft Word doc on your computer or pen and paper, we're going to do something at the end that we'll need you to write something down, so just be prepared for that as well. The objectives for today are for you all to meet the statewide COVID-19 Crisis Community Resource Specialist, which is us. You'll also understand a little bit about how the COVID-19 public health crisis is affecting each of us here in Idaho. And finally, you'll learn a little bit about how to engage in emotional support resources to help you boost resilience. And I'm going to turn it over to Wesley.
Hi, everyone. My name is Wesley Neisler, and as Claudia mentioned, I'm going to reiterate a few things Claudia just mentioned of what exactly Idaho Strong is. Idaho Strong is a grant program funded through a cooperative agreement between SAMHSA, the Substance Abuse and Mental Health Services Administration, and FEMA, the Federal Emergency Management Agency. Idaho Strong's primary goal is to provide crisis counseling services and resource connection to Idahoans impacted by COVID-19 using a three-pronged approach. For the first prong, we have the COVID Help Now line, which is a free crisis counseling phone line available statewide from 8 a.m. to 8 p.m. Mountain Time. staffs on the COVID Help Now line are warm and skilled individuals contracted through BPA Health that can help callers manage their emotions, get connected to resources that they may need in the community, whether those resources are rental assistance, food assistance, school supplies, utility help, and so on. The second prong of Idaho Strong is the COVID-19 Community Resource Specialists, or CCCRSs, or kind of short, which is who you are meeting today, and that's us. We have one CCCRS for each region of Idaho, according to the region layout put forth by the Division of Behavioral Health, which I'll get to a little later on. As CCCRSs, we serve as the boots on the ground for this project. We make sure entities in our local communities throughout the state are aware of Idaho Strong and resources that are available to them. And we also handle referrals from the COVID Help Now line for callers who may need more specific or additional assistance than what the Help Now line staff can provide. We will describe a little more later on about our roles as CCCRSs shortly. And the third prong to Idaho Strong is the social media and outreach campaign ran by Idaho Office of Emergency Management, or IOEM. The social media team has established statewide advertisement for Idaho Strong, including billboards across the state, radio advertisements, TV advertisements, as well as social media pages, including Instagram, Facebook, and Twitter. The primary goal of the social media and outreach campaign is to develop the branding of Idaho Strong and get the word out about our program. And if we get the next slide, please. And just to clarify a little bit about our roles, CCCRSs, we work within the Division of Behavioral Health at the Idaho Department of Health and Welfare in response to the pandemic. And we have the purpose of helping people understand their emotions and develop coping strategies that work for them, as well as to help people get connected to resources in their communities. And next slide, please. But those are not the only things we do. In addition to the local outreach and providing additional assistance to callers referred to us from the COVID Help Now line, our team has been working independently and collaboratively on a variety of things, including groups to develop community members' repertoire of stress coping strategies and resilience skills. And we have also been hosting informational sessions and sometimes a combination of resilience groups and informational sessions, much like this one. We have established pen pal programs in nearly every region of Idaho between schools and nursing home facilities. And we have been making a number of other creative connections that we will highlight in a few moments when the rest of the team gets a chance to introduce themselves. And next slide, please. As you can see here, these are the regions of Idaho according to the Division of Behavioral Health within the Department of Health and Welfare. And you can see they're numbered. For example, I'm the CCCRS for Region 2 of Idaho, and that's highlighted in red there. So I cover Latah County, Lewis County, Nez Perce, Clearwater, and Idaho County. So you can find which county you live in there and see your respective CCCRS. To reiterate, again, my name is Wesley Neisler. I cover Region 2 of Idaho. To highlight just a few of the things that I've been doing, and I've been involved with several local groups and coalitions in Region 2, presenting to an array of entities about our program. And I've also had a fair amount of personal experience with mindfulness and meditation, which is an excellent tool to use during stressful times. So I'm working to teach and implement this specific stress management skill in the lives of the people of Idaho. One of the ways I've done this is by working with a media campaign to establish what we call Mindfulness Monday posts on our social media channels. Every Monday, our social media channels provide a post expressing the significance of mindfulness and meditation, as well as specific exercises that people can implement in their own lives quite easily to live a more relaxed and focused life. And I'll turn it over to Lillian.
My name's Lillian Toomey, and I work in Region 3, so Adams, Washington, Payette, Gem, Canyon, and Owyhee counties in the southwest region of the state. And I have been working on the community pen pal program between nursing homes and schools, as well as conducting a lot of outreach in Spanish to help make sure I can reach Spanish-speaking residents of the region. I've also hosted a couple of group info sessions and group talk sessions for employees of a local social services organization, and for another hub meeting of different members of social services organizations. That's another role that we can play in the community.
My name is Jennifer Ramos, and I am your CCCRS for Region 5. covering Blaine, Burleigh, Camas, Cassia, Jerome, Lincoln, Minidoka, and Twin Falls counties. I've been working closely with the food banks in my area to include going out and helping distribute boxes with our information. And then I've also been working to get the Pen Pal program started. Our goal is to get the elderly population feeling less isolated by connecting them with the younger generation through letters, and the nursing facilities and the schools have all been very excited about this.
And I am Tara Contreras. I am in Region 6. So I cover Bannock, Bear Lake, Caribou, Franklin, Oneida, and Power counties, or southeastern Idaho. I have a long history of working with vulnerable populations and doing a lot of resource connection already. So I've worked strongly with some of our larger community partners that are really quick, and they have a relationship that they'll send me over those one-on-one referrals, and so I can support those individuals, and then also working on the Pen Pal program, getting that up and going in my area.
My name is Shannon Fox. I am the CCCRS for Region 7 of Idaho. I work with the eastern communities of Idaho, including Bingham, Bonneville, Butte, Clark, Custer, Fremont, Jefferson, Lemhi, Madison, and Teton counties. Within those communities, I've been working with agencies who provide a lot of services to vulnerable populations to support those vulnerable populations, and also to help support the staff of those agencies who are also experiencing a lot of stress. I've also had the chance to work with local officials like mayors and county commissioners and city councils to help educate them on the resources that are available to their constituents. I've also had the opportunity to work with schools and actually start a student group, a student support group within an alternative high school where students come together and we help lead them through things that they can do to navigate these stressful times. So that's a little bit about what I do. And we also have Regions 1 and 4. They are being covered by current CCCRSs, but we're actually bringing members to our team to help cover these regions and take over in that personal interaction with those communities. So we'll have those people joining our team shortly.
And we wanted to talk a little bit today about another program that DHW is offering. It's separate from Idaho Strong, but it's another great resource for people during the pandemic. It's called the Counseling Assistance for Frontline Workers program. And the link to the website is there at the top if you're able to take a screenshot maybe, or just take a quick picture with your phone if you want to consult this website later. The way it works is licensed professionals are provided to those in Idaho who are frontline workers. So anybody who is a medical worker, a first responder, or any other kind of frontline employee who needs therapy, who needs counseling, professional counseling, can access it through this program, because we know those individuals have an increased risk for secondary traumatic stress reactions during this time. So this program is really, really great. It has kind of two approaches. One is if you call this number over here on the right side of your screen, and you are someone who's a frontline worker and you are already insured, the service will help screen and navigate you to the best professional to help meet your emotional and behavioral needs. So that could look like telehealth or in-person professional counseling, kind of whatever works for you. And the people on the phone will be able to help you with finding a provider that's covered under your insurance and covering any co-pays that may not be possible for you to pay at the time. The other option is a free 5-session program. So for those who are uninsured, this is great for people who don't have access to counseling or therapy. They can call into this number and find 5 free sessions of professional assistance during this time. So just wanted to highlight again the number on the right side of your screen to help you get a little more info about this great resource, and you can also access the website there at the top.
So COVID-19 is impacting all of us. Let's think about that and say it again. COVID-19 is impacting all of us. It has changed so much this past year. Not only basic things like the need to have a mask on you at all times, but bigger, more important things like birthdays, graduations, and even our recent holidays holiday season had a really different feel to it. The fact is, if you haven't had COVID, chances are you know someone who has. And though you may not have lost a job or a loved one, there's a sense of normalcy that's been lost for everyone. Next slide, please. So these are the phases of disaster. This is a linear look created by SAMHSA that shows us phases that come along with natural disasters. There's 6 phases, but we will not necessarily all be in the same phase at the same time. I may be experiencing one phase while my neighbor is not there yet, or I may be in phase 4, see something in the media that makes me backslide to phase 3, and that's perfectly okay. And we're going to see here that although COVID is a pandemic and it's not a natural disaster like a hurricane or a tornado, see by looking over these phases, it has affected us very much in the same ways. So phase 1 is the pre-disaster phase. It's characterized by fear and uncertainty. For COVID, this would have been the first few days when we had heard about it on the news. And for places like Idaho, it may have even lasted a couple of months into the pandemic because it wasn't affecting us the way it was places like New York. So the fear and uncertainty lasted longer than in the typical case of a natural disaster, such as a hurricane, where you can watch on the news and keep updated with the strength and the path and see if you're going to be in harm's way. Phase 2 is where there are a range of emotional levels and reactions. Reactions range from shock to panic. At the beginning of this phase,